Hello there, everyone. My name is Alan Dietrich Ward, and I am the moderator for tonight's event and the editor of the Pennsylvania History Series published by the Pennsylvania Historical Association in partnership with Temple University Press. I'm delighted to welcome you here for our discussion on the health of the Commonwealth, a timely topic, of course, for today and for the future for those who will be joining us in the years to come. So in addition to myself, I have with me a fantastic set of colleagues, including Jim Higgins, the author of Health of the Commonwealth, the public health history of Pennsylvania. That was our most recent publication in the Pennsylvania History Series. I also have my friends and colleagues, Dr. Drew Simpson and Dr. Carol Weaver, who I'll be introducing a little bit later in tonight's webinar. The Pennsylvania History Series, as I noted, is the publication of the Pennsylvania Historical Association and Temple University Press. I have been delighted to be the editor with my colleague Beverly Tomek, who was the co-editor on Jim's book, and now joined by David Whitwer, my new co-editor for the series. It's been a great pleasure to serve as the co-editor, and I'm so proud of the books that have come out of our series. The Pennsylvania History Series is designed for use in the undergraduate classroom, as well as you'll see from the topic of tonight's book on topics of broader scholarly and public interest. Jim's book on public health history is certainly an example of that. I'd like to thank Jacob Wolf, our technical director for tonight's webinar, as well as the Pennsylvania Historical Association for hosting us this evening. And last but not least, of course, our three panelists for this evening. So it is my great pleasure to introduce Dr. Jim Higgins, a lecturer in history at Rider University, and the author, of course, of The Health of the Commonwealth, A Brief History of Medicine, Public Health and Disease in Pennsylvania. Jim is the recipient of numerous awards, including those by the Pennsylvania Historical Association for an article that actually served as the foundation for the wonderful book that he published in 2020. So with that, Jim, I'd like to turn things over to you and give you our first question for the evening. Can you tell us a bit about this book? What was your overall goal? And how did you end up structuring your analysis of such a huge and all-encompassing topic?
Well, the short answer is that you helped me out a lot. The more detailed answer is that I was kind of setting myself to try to give a general history of healthcare writ large. So not just conventional medicine, but also unconventional medicine. Over the course of, several centuries of history in a state that has had an extraordinary influence on American medicine. And in many ways, my overall analysis was to try to bring as much as I could to the table from all sorts of healthcare and medical perspectives. So that includes not just private medicine, but also public health and public medicine. For those of us in the field, it's an important distinction between, for instance, quarantining a community and actually setting up a public hospital. And that was the real challenge, to try to force, if you will, this broad topic into something that was condensed enough so that undergraduates, perhaps a general reader, would find something interesting, but including enough primary documentation that the scholar would also be able to walk away having had a fruitful read.
Excellent, Jim. And just as a follow-up question, for those who haven't read the book yet, could you just talk a little bit about some of the key ideas that you brought up in it?
Sure. I think if I kind of break this into units, the first third of the book really deals with medicine in the pre-bacterial era. And it is rather like, I mean, you have to feel for people who are trying to extend medical treatment, that adage about feeling around in a dark room and feeling a portion of the elephant. Um, and yet I didn't want to relegate that time period of medicine in Pennsylvania to a kind of antiquated status. Advances were made. Advances in our medical schools, at this point only in Philadelphia, through the 1840s were made. Advances in surgery. And then the next big period really is the coming of the age of bacteriology, the recognition that microbes are causing disease revolutionizes in a very short period of time. In the 30 years following the discoveries of Pasteur and Koch and Lister, we add more to our understanding of medicine and physiology than I would argue in the 5,000 or 6,000 years before it. And after that, we have this period where antibiotics, antivirals, we've already cleaned up our water supply. And so we kind of move into what I think most Pennsylvanians, most readers would recognize as kind of a more modern age of medicine. We're no longer concerned really about microbial disease as a real shortener of life expectancy. And so we've moved into a kind of biotechnology revolution in the late 20th and early 21st century, where I remind readers we have forgotten about public health to a large degree until somewhere around January, February 2020, where public health all of a sudden came right back on the landscape for us all.
Yeah, and I really appreciate you bringing that up, Jim. I know from a careful study of your book that is really one of the subtexts of it, that Pennsylvania in some ways has really excelled in the 20th century in developing this kind of industrial health complex in which great discoveries are made, kind of from Jonas Salk, through to the organ transplants and the biotechnology and the startups of the
Sure.
late 20th and early 21st century, but that there has been this struggle as healthcare has been privatized. Our public health infrastructure has suffered, and I would imagine that for you, watching the struggles over the past year has, in some ways been not an "I told you so" moment, but in a
it's been heartbreaking.
Yeah, in a we have seen this before, and we should know how to do this better.
Yes, we, the great middle class, we pride ourselves on being able to provide our families, ourselves with physicians, private physicians through our insurance, and we have, I think, forgotten the importance of the entire community in terms of staying well and being well. And so we don't think of water sanitation, water plants. I mean, you flip on your tap, you expect that you're not going to be poisoned by your water. This was a public health fight that went on for decades at the turn of the 20th century. Now it's just part of what our cities do, right? What our municipalities do. And so we have kind of, I think, shunted public health off into a corner. And unless there's an outbreak of salmonella and somebody from the State Health Bureau shows up, we don't think too much about it.
And thank you for that. And even as you're saying that, I'm just thinking to the extent over the past few years, how even that infrastructure of water, in thinking about the lead crisis in water, even that has become challenged. Our belief that we have conquered nature oftentimes is revealed to be quite shallow. So
Indeed.
Thank you so very, very much for that overview, Jim. And that's going to, I think, just set the stage perfectly for the rest of our discussion. And to begin that, I am delighted to introduce my good friend and colleague at Susquehanna University, Dr. Carol Weaver, who's a professor of history at Susquehanna, an expert in medicine in Pennsylvania, and particularly in the role of women caregivers in the history of the state. Her most recent book is Medical Caregiving and Identity in Pennsylvania's Anthracite Region, 1880 to 2000. And I'm delighted to turn things over to Carol Weaver.
Thank you, Alan. Jim, I have one question for you, and then if time permits, perhaps a follow-up. So I was wondering if you could talk about the significance of nurses in the history of medicine in Pennsylvania.
Certainly. Nursing, yeah. Nurses are, in the 19th century conception at least, a kind of an extension of what they saw as traditional duties for women. But nursing, I think we should expand the categorization, look at it through the eyes of mothers, of wives, of daughters. So both trained and untrained nurses. Our trained nurses really only come about in the late 19th century. I think it's very difficult for people to conceptualize, to envision a world in which they are being attended by a physician with no skilled nursing available whatsoever. And your skilled nurses are what make your hospitals run. I mean, they do, when you're talking about patient time, they spend far more time with the patient than a physician. Their duties absolutely demand it. We see women being pushed aside by the turn of the 19th century in favor of male physicians, and males obviously dominate the world of physicians. But then there's this recrudescence of women in medicine by the late 19th century. And Pennsylvania, to understand just how deeply involved Pennsylvania is, the greatest employer of post-high school educated women in the first 2 decades of the 20th century in Pennsylvania was the Pennsylvania Department of Health under Samuel Dixon, literally employing hundreds of trained and graduate nurses. It's also important, and I don't think you get the sense of this from places like Philadelphia and Pittsburgh, but if you look at the hospital construction in Pennsylvania, late 19th, early 20th century, in what I consider out of the way places, Tioga County, Elk, these small municipal hospitals, many of them, most of them, also open up as part of their first or second year's order of business a nursing school. Because you open up a hospital in Bradford without nurses, really, what's the point? We all know the horror stories of bringing in volunteers, or families are coming in to take care of you, or if you're at Philadelphia General Hospital and other hospitals, having the fellow patients take care of you for good and for ill. I think most of the time it's for ill. And we now come through an evolution in the 20th and early 21st centuries, where I think if you take the nurse of 1920 or 21 and you let her a little window into 2020, 2021, they'd be fascinated and shocked by the enlargement of duties and the specialization of duties that nurses have today. It's not just your operating room nurse or the nurse at the doctor's office. It's specifically the nurse who's in oncology care, specifically in geriatric care. And so to talk about, you can't really talk about the history of medicine, especially in the era in which Pennsylvania exists, without talking about the nurse and their highs and lows in Pennsylvania medicine.
Thank you, Jim.
Thank you.
Mm-hmm. Do I have time for one more? Okay. What other areas of research might historians of Pennsylvania medicine focus on in the future? Is there anything understudied?
Is there anything understudied? I argue that we've done a good job with New York City, with Massachusetts. There's almost no investigation at all of those smaller county hospitals that I've talked about before. And when I was doing actually some of the research for this, I was able to make connections with some of the smaller hospitals in the northern tier of the state. And there are books, articles, dissertations, and theses waiting to be written in those smaller hospitals. They revolutionize maternity care, absolutely revolutionize it in the rural areas of Pennsylvania. And in fact, rural healthcare in the state, I look at it in my next work from bringing science to the rural areas, but we don't have we don't have much of an understanding of the ins and outs in the mid and late 19th century of the rural areas, and I mean truly rural areas, not the Lehigh Valley, not up around Wilkes-Barre, but in some of the counties that we don't think about too much because no major highway goes through and no major city or industrial site is there. And I think we would also be able, we'd do a much better job if we looked at some of the unconventional providers of medicine, and actually some of the tension that begins to really exist from about the 1880s on, as led by the health department of the state of Pennsylvania, but also just led by a kind of conventional medical education. And so we are getting rid of diploma mills. The state, by the second decade of the 20th century, says we are going to have a unified board of medical examination. And that leads also to, I think, some really good studies that can be done on the history, the early history of osteopathic medicine in the state, which is entirely unlike osteopathic medicine that is practiced today. I think that's absolutely an area that scholars should go into and take a look at.
Thanks, Jim.
Thank you.
Thank you so much, Jim, and thank you so much, Carol, for those absolutely fascinating set of questions. I love the notion here of really taking a deep dive into what it is that makes public health and medical history, what makes them. I mean, there are these diverse components throughout the state's history that kind of coalesce around something and form something, even though they, in many ways, they originate in different, they originate in completely different spheres. And we can see that today, I think, still with the variety of different medical practices that exist. We have oftentimes have our medicine cabinets that have our, allopathic medications, pure double-blind, peer-reviewed studies. Sure. Sitting right next to our elderberry extracts and our essential oils. So for me, there is this, fascinating story of determining and defining what medicine is and what health is. And in some ways, I think separating out the physical and the mental health, which in many ways, historically, I think would have been seen as one and the same, how they have kind of been pulled apart. And then I think in recent years, in some ways, being put back together again with a recognition that health goes beyond merely keeping the blood flowing and the heart pumping. So thank you so much for that, Jim and Carol. What fascinating, opening a set of fascinating topics. So I'm going to turn next to our other panelist, Dr. Drew Simpson, who I am pleased to announce has now been promoted to Associate Professor of History at Duquesne University. So
congratulations.
I don't know when that is official, but and forgive me for jumping the gun, but we are all so happy and so proud of you, Drew. And I should note that the honor of Associate Professor comes on the heels of an absolutely fantastic book that I've had an opportunity to review and draft, and now have sitting right next to me on my shelf, The Medical Metropolis, Healthcare and Economic Transition in Pittsburgh and Houston, published by the University of Pennsylvania Press in 2019. So I can't think of a better person to hand things over for the last third of our webinar. So Drew, please take it away.
Excellent. Well, thank you, Alan, and I appreciate that very kind introduction. And it's really great to be here with Jim and with Carol and with everyone here in the audience today. I had the opportunity to get to read a version of Jim's book a little bit early. And one of the things that really struck me is a line that sticks out early in the introduction. And I think it's an important thing to frame the discussion. It certainly framed how I thought about my questions. And Jim writes that his book rests on the premise that the history of medicine is no less vital to understanding the state's past than its political or its industrial history. And I think this is such an important role that this book plays in really showing that Pennsylvania's medical history is central to its development as a Commonwealth, not just in the second half of the 20th century, where we often think of the story of Pennsylvania being one of development in Pittsburgh, which I write about, or in Philadelphia. So I think that's a really fantastic contribution of the book. One of the things that struck me as I was reading the book, and this is my question for Jim, is he makes an argument that Pennsylvania's medical history is both similar to other places and unique. And I was struck by the way that knowledge flows into Pennsylvania, but is also exported from Pennsylvania. And I wonder if we could maybe dig into that a little bit more. And the things that I, of course, thought about were smallpox, changes in therapeutics and medical education, but also the way that in the 20th century, financial knowledge about healthcare is exported from our state. And I wondered how you sort of conceptualize the sort of knowledge flow, and if you thought that the Pennsylvania story is unique, and if there's also, to build off of Carol's question, new ways to sort of address that for historians.
I think it is unique in, Pennsylvania is one of the first of the original 13 states. And Philadelphia was the center of commerce until New York kind of edges it out in the early 19th century. Despite that edging out in terms of population, Philadelphia specifically is the center of medical publishing in the country until well into the 19th century. The College of Physicians of Philadelphia is probably the best of its kind in the 18th and 19th century. And of course, you have the University of Pennsylvania School of Medicine, followed a bit later in the 19th century by Jefferson College of Medicine. And so it forms this interesting basis where we have physicians or would-be physicians studying first in Edinburgh, and then later on in England, France, and Germany, importing knowledge from the Paris School of Medicine, disseminating that knowledge mostly in Philadelphia. But then if we get outside of Philadelphia, you can argue that the home of homeopathic medicine in the country for quite a long time was the Lehigh Valley, with both a hospital and the forerunner of the Hahnemann Hospital opened up in Allentown, the county seat of Lehigh. Allentown, when this happens, 1830s, is a town of 6,000 or 7,000 people. I mean, there's nothing special about it whatsoever in the middle of a German, Pennsylvania German region. And for me, it is important that as we're looking at other states, especially in the late 19th century, that are still allowing diploma mills to set up. You go in as a 16-year-old, you can come out as a 17-year-old doctor. You've never worked with a patient. We have a state medical society that is attempting to impose more conventional scientific-based standards on physicians. And we have in Philadelphia and to a growing extent in Pittsburgh, especially after about 1905, 1910 with the publication of the Flexner Report, we have two extraordinarily robust centers of medical knowledge, education, and treatment in this state. We have, and I've just kind of finished exploring this for another, I shouldn't be talking about another book, the first head of the Department of Health, who gets into an international affray with Robert Koch over tuberculin. And he shows in Berlin in 1890, look, I beat you with the attenuation of tuberculosis bacteria. I beat you with developing immunity in guinea pigs. And your serum is actually killing people, and mine might not do anything, but we're not putting people out of this office in caskets. So we have, and this is one of a number of instances of a Pennsylvania scientist, and this guy's a proud Philadelphia Quaker, who are competing at the absolute uppermost levels of medical science in the Western world. The people who are working with Koch or working against him, Pasteur, Lister, Ehrlich, these top names. And so I think it's very important to understand that this isn't just a story about importation of medical knowledge to Pennsylvania in the late 19th, early 20th century from generally Europe. This is actually about homegrown medical knowledge then also being disseminated out from Pennsylvania. This is continuing today in Pennsylvania. If we look at University of Pittsburgh School of Medicine and University of Pennsylvania School of Medicine, continuously for decades now ranked in the top 10 of medical schools in the country, and with specialized hospitals like CHOP, always ranked in the top 3, 4, or 5 in their categories in the United States. And so we are, like we are with higher education throughout Pennsylvania, we hit way above our weight, pull in much more money than we send out in terms of higher education and in terms of medical education in our state. When you add Hershey School of Medicine to an allopathic School of Medicine to it in Jefferson, it really is extraordinary how Pennsylvania has continuously built upon a foundation that stretches back to the Russias and the Shippens of the 18th century.
Thank you so much for that answer, Jim. And particularly there, I noticed the nod to my hometown with Edward Shippen. So thank you so much for that. And thank you, Drew, for an absolutely stimulating question. And speaking of stimulating questions, I am delighted to ask our last question for the evening, which comes to us from our audience, from Tyler Stump, who asks a question about the future historian and the public health records that he or she will need. That question is, I think, can you see it there, Jim?
I cannot.
Let me answer it. Let me ask it here right then. I suspect the public health medical history of PA in the 21st century will be of great importance to historians of the future, Tyler says. What sort of records, stories, and materials need to be preserved from the present so that future generations can learn from what's going on today?
Well, on the one hand, I'm not, after the last year, I'm not convinced that the public's going to learn from the public health disasters of the past. Okay. We have allowed a generation of our grandparents to be buried. And much of the argument is over whether or not we really have to wear masks or whether or not we can actually go down and get a drink at the local bar. But if we're looking at your scholarly historians, one, the records from the State Department of Health, which is your kind of overarching public health body in the state, are going to be absolutely critical. Director Levine, who is now in Washington, D.C., and I don't think you can calculate that loss to our state readily. She was on the scene of the worst medical emergency in Pennsylvania history since the flu, and had to deal not only with this virus, but with the slings and arrows that are being tossed at her by people who, have competing interests besides just clamping down on the spread of a respiratory virus. And so I think coming out of her office, the papers that are kept there are going to be important. I would hope that Dr. Levine, I would hope that she writes a memoir of some sort. If for no other reason than we have a document from the person who's there. It's when you look back at, for instance, in 1918, you don't have those from departments of health. You don't have heads that are writing memoirs that we can easily go back and take a look at. I wasn't able to do it with my studies of the flu. Benjamin Franklin Royer, the acting commissioner of health in 1918, early 1919, you have to figure out what's going on from public records. So it's very important to keep those archived. Pennsylvania has almost, outside of your major cities of Philadelphia and Pittsburgh, we have very few public health government controlled resources. So Lehigh County, one of the most populous of our counties, doesn't have a county board of health. We do have the Allentown City Board of Health, the Bureau of Health. So the records that are going to be kept are going to be either at the state level or they're going to be at the municipal level. And I think there's going to be a dearth of resources when the future historian comes back and looks at all of the media stories that kind of count up or count down, if you will, of deaths during this pandemic. And I think this is coming in the years ahead as we are forced to redo our infrastructure in this country, right? Not just roads and bridges, sewer lines, and what are we going to do with solid waste disposal? Okay. My part of Pennsylvania takes in a lot of garbage from New Jersey and New York City, and there's pushback on that. These are all public health problems. We had a landslide of a garbage mound a couple of years ago outside the city of Easton, Pennsylvania, where people couldn't even sleep at night in their homes because of the reeking of the garbage. there wasn't, besides finding a multi-billion-dollar company a couple $1,000s a week, there wasn't much that the municipal authorities could do about it. Well, there was a slide and you knew it could happen and you allowed us to put it here in zoning. So I think that the future scholar is going to have less material, comparatively speaking, than the scholar of public health who's looking at the 19th and the early 20th centuries, again, because people 100, 120, 130 years ago began connecting the dots. I don't want my kids dying of diarrhea in September and October. Let's get together, we'll have a tax and we'll filter our water. Maybe we'll add chlorine to it a little bit later. We are a society that in many ways is adverse to things like public health. We want to handle it on a private basis. But certainly the archives that are kept in Harrisburg, the papers that will be going into it, with the understanding that HIPAA is probably going to have an effect on what exactly we know about patient information and the individual patient. I get chapter and verse of a man who makes Mary Mallon look like she just had a kind of a slight stomach upset. And for 10 years, this guy poisoned the water supply up in Plymouth, Pennsylvania. You know, I think the State Department of Health would probably not today release the first name, last name, address, and the name of his kids and wife. Probably aren't going to be released like that in the 21st century. So it's going to be a bit more difficult. What I also hope, though, is that the future scholar is going to be able to look back on the 2020s and the 2030s and see hopefully a resurgence of public health in the state of Pennsylvania. I'm not entirely hopeful, but this could be one of the long-term consequences of this awful pandemic.
And on that note of thinking about the ways in which the past influences the present and can hopefully change the future, I'd like to thank very much Jim Higgins, author of Health of the Commonwealth, as well as our fantastic panelists tonight, Dr. Drew Simpson and Dr. Carol Weaver, for what is undoubtedly one of the most important, I think, topics, a conversation on one of the most important topics, certainly in my lifetime. So thank you all so much for joining us. And thank you once again to the Pennsylvania Historical Association and to Jacob Wolf for making this webinar possible. My friends, good luck, safe health,
Thank you.
and we'll look forward to seeing you again in the next webinar in our series. Thank you so much.
Bye, guys.